So today, we're going to dive into something pretty incredible. We are going inside one of the largest public health systems on the planet to see how they're building an AI ecosystem you can actually trust. And the really wild part? It's all being orchestrated from the ground up by a single, visionary architect. Okay, let's just get right to the heart of it. How do you build artificial intelligence you can trust when millions of lives are on the line? I mean, this isn't about a chatbot for ordering pizza. We're talking about life or death decisions. The stakes just don't get any higher. And the answer, as you're about to see, is a lot more than just clever code. But before we even get into the how, we have to understand the why. The whole mission behind this massive project, it isn't really about the tech. It's deeply, deeply human. It's about tackling the crushing pressure on the healthcare system and finding a way to help the clinicians on the front lines. You could even call it a mandate to heal the healers. And believe me, those pressures are real. We're talking about a perfect storm here. Rising burnout among doctors and nurses, ED wait times getting longer and longer, and more people dealing with chronic diseases. And all the while, Queensland Health knew they were sitting on this absolute mountain of data that could help, but they needed a completely new way to unlock it, to build a system of care that was truly connected and personal. And this is where the architect of this whole plan, Adrian Xavier, enters the picture. He saw that to tackle these huge challenges, you couldn't just go out and buy some off-the-shelf AI product. No, you needed a blueprint, a complete vision for one single, unified AI ecosystem. See, Adrian's vision was architectural from the very beginning. Instead of just buying a tool, he designed a system, a framework that could grow and adapt. It's modular, it's scalable, and most importantly, it has security and trust baked into its very DNA, not just bolted on as an afterthought. So let's look under the hood at the engine he designed. This isn't one giant AI brain. Think of it more like a team of specialists. The knowledge base is crucial. It grounds the AI in medical facts using something called RAG. Basically, it forces the AI to look up answers in approved documents before it speaks, which stops it from just making stuff up. The tools module gives it hands, letting it securely connect to things like patient records. The router acts like a traffic cop, sending each task to the right AI for that specific job. And all of this is delivered through what they call the QTAF, the Trusted AI Fabric, which is the platform that makes all these modules actually work together and automates all the compliance. Okay, so you've got this powerful technical engine. But, a powerful engine without a strong chassis and clear rules of the road is just dangerous. That's where governance comes in. This is the part where the incredible tech meets the messy real world, and it's where this architecture of trust really starts to take shape. And the first, and maybe the most important pillar, is all about the data. In healthcare, data is everything. It's the most valuable and the most sensitive asset you have. So this standard lays down the absolute non-negotiable rules for how any AI is allowed to handle it. This is really the foundation of the entire system. It says that every single piece of data the AI ever touches has to be authenticated, has to be reliable, and it has to be representative of the real patient population. This is what feeds that knowledge base we just talked about, and it ensures that the old garbage in, garbage out problem simply cannot happen here. It's a hard line in the sand for patient safety. And you can see these core principles in action right here. It goes way beyond just accuracy. Privacy and security by design means you're building safeguards in from day one, not trying to patch them in later. And bias mitigation, well, that is absolutely crucial in healthcare. It's about proactively making sure the AI's advice is fair and effective for every single patient, no matter their background. All right, on to the second pillar, security. And we are not just talking about your standard firewalls and antivirus software. This is about defending the AI's mind from a whole new generation of threats that are designed specifically to fool and exploit artificial intelligence. The foresight here is just incredible. Adrian's architecture plans for threats like prompt injection, where someone tries to trick the AI into breaking its own rules. To fight that, they literally developed an entire prompt engineering standard. It also defends against adversarial attacks meant to fool the AI with tricky data, and it protects against model poisoning, where someone tries to corrupt the AI while it's still learning. This is a fortress designed for a completely new kind of warfare. So we've got the technical blueprint, we've got the rules of the road, but how do you actually apply all this consistently for every new AI idea that comes along? Well, that's where FARA comes in. Think of it as the systematic engine that Queensland Health uses to check for and manage risk before anyone even starts to build anything. This quote from the Standard really says it all. There are zero exceptions. It doesn't matter if an AI project seems small or totally harmless. Every single initiative, big or small, has to go through this formal risk assessment. It's an absolute system-wide commitment to a safety-first culture. And the process itself is just incredibly logical. Part A is the tech deep dive. What does this thing actually do, and what data does it need? Part B is the ethics checkup. Does it align with our core values like fairness and patient safety? And then Part C is the action plan. Now this part is key. To create that plan, teams use something called the ACL, the AI Assurance and Controls Library. It's like a pre-approved playbook of solutions to known risks, which makes sure that the fixes are always consistent, strong, and properly vetted. And what's really smart about this is that it's not a one-size-fits-all nightmare of bureaucracy. The system is intelligent. If a project is low risk, say an internal admin tool, it can be managed at the local hospital level. But anything that's moderate or high risk, that gets escalated for a central review by the top experts in the state. It's a really smart, proportionate way to handle oversight. Okay, so let's zoom back out for a second. We've seen the technical blueprint, we've seen the governance pillars, and we've seen the risk management engine. When you start to put all of these pieces together, you really begin to see the full, breathtaking scope of Adrian's vision. And this is how it all connects. The technical framework, the data rules, the security protocols, the risk assessment process, these aren't just separate documents sitting on a shelf somewhere. They are interlocking gears in a single, coherent machine, a system that was designed from the ground up to produce one thing: trust. Because at the end of the day, the goal was never to replace clinicians. It was to create trustworthy AI that could act as a co-pilot, a system that can handle the endless administrative work, that can summarize huge amounts of information, and ultimately free up doctors and nurses to focus on the complex, human work that only they can do, caring for patients. If you take away one thing, it should be this. This entire complex ecosystem of technology and policy and process, it didn't just happen by accident. It was built, piece by deliberate piece, from a single, unified architectural vision for what safe and ethical AI in healthcare has to look like. Which really leaves us with one final big question. By building this comprehensive architecture of trust, has Queensland Health, under Adrian Xavier's direction, actually created the global blueprint for how any government, any public institution should approach AI from now on? It's definitely a question worth thinking about.